Kwa hiyo hata huduma tunazotoa ni za kiwango cha juu zaidi. Tunatoa huduma za kitaalamu na ushauri.
In Tanzania, more than 75% of its over 45 million inhabitants live in rural areas, where access to pharmacies is limited because licensed pharmacies are located almost exclusively in urban areas. Primary healthcare facilities provide basic services but sometimes run short of essential drugs. In the past, most rural Tanzanians sought healthcare and medicines from small retail drug shops called Duka la Dawa Baridi, which constituted the country's largest network of licensed retail outlets for purchasing over-the-counter medicines.
Most of the essential drugs were channeled through the government-owned dispensaries and health centers, and sometimes there was shortage of these essential drugs. But you cannot provide every essential drug. There must be another outlet.
Umbali wa kutoka hapa mpaka dispensary ni kilomita 3. Na umbali mpaka wa kutoka hapa mpaka kwenye pharmacy ilikuwa ni kilomita 25. Lakini matumaini yetu makubwa sana ilikuwa ni duka la baridi ambalo lipo jirani hapa.
Before 2003, Duka la Dawa Baridi were only authorized by the regulatory authority to provide non-prescription medicines. Many of the drug shops were selling prescription medicines illegally because inspection and regulatory enforcement were inadequate. The quality of medicines could not be assured because shops did not have places to store medicines properly and often charged high prices to customers. The dispensing staff also lacked basic qualifications and training.
Some people are overdosed, some people are underdosed, or they get expired drugs.
In 2003, recognizing the potential public danger, Management Sciences for Health, under the Strategies for Enhancing Access to Medicines program that was funded by the Bill and Melinda Gates Foundation, collaborated with the Tanzanian Food and Drugs Authority to develop and launch the country's successful Accredited Drug Dispensing Outlet program, now known as ADDO program.
Instead of closing them, we said we needed to come up with another strategy of how best we can improve or upgrade the standard of practice in these particular shops. So that's how, based on the assessment that was conducted in 2001, we now came up with a concept note to design the project, the so-called the Accredited Drug Dispensing Outlet, the ADDO program.
With the new program, Duka la Dawa Baridi must qualify to become a Duka la Dawa Muhimu, which is an accredited shop and meet the ADDO program standards. In August 2003, the program was first launched as a pilot in the Ruvumu region in Songea, the region's capital. Many community members came out to join the celebration. The goal of the program was to improve access to affordable, quality medicines and pharmaceutical services in areas where few or no registered pharmacies existed. To achieve this goal, and for the new program to be sustainable, effective regulation was needed, as well as business incentives for the shop owners to invest in accreditation. Training the dispensers was also considered as a critical element of the program's success.
Tuliweza kujifunza mambo mengi kiasi kwamba sasa hivi tumeweza kuwaelimisha wagonjwa wetu juu ya matumizi sahihi ya dawa, maana wengi wao walikuwa wanakuja katika maduka ya dawa baridi ya mwanzoni anataka vidonge viwili, lakini sasa hivi akija akitaka vidonge viwili tunamuelimisha madhara ya kutumia vidonge viwili na faida za kumaliza dozi nzima.
The shop owners in turn must operate their shops in an ethical professional manner, guided by the Duka la Dawa Muhimu regulations that provide specifications for premises, personnel and training, record keeping, inspection and sanctions, the expanded drug list, and a code of ethics. If owners do not comply with the regulations, they risk losing their accreditation status.
Although training and the incentives and marketing is important for the sustainability of the program, still there was a major component, the control mechanism. At ward level, we have appointed ward inspectors. The ward executive do not have really an authority over the shops, to make final decisions. They are supposed to report to the upper authority, the district drug committee, who will take final decisions and sometimes get in touch with the TFDA.
By 2004, the Tanzanian Food and Drugs Authority had accredited over 150 shops in Ruvuma, and an evaluation showed that ADDO's improved access to quality medicines and pharmaceutical services.
Tathmini ilifanyika sasa ilionyesha kwamba asilimia ya dawa ambazo zipo katika maduka ya dawa muhimu ambazo hazijasajiliwa zimeshuka kutoka asilimia 26 hadi asilimia 2.
Based on these positive results, the Ministry of Health and Social Welfare approved a plan to roll out the ADDO concept to the rest of the country, and the government committed funds to expand the program in Mtwara and Rukwa regions. Development partners also started supporting program rollout in other regions. ADDOs are now being used for several other national programs, such as the Integrated Management of Childhood Illnesses, providing information on HIV and AIDS, family planning pills and condoms, and distributing treated mosquito nets, subsidized first-line malaria therapies, and water purification preparations.
The child health component of the ADDO program had an approach of training the ADDO dispensers together with supervision or making follow-up to the ADDO train. And we were really focusing on, in the training, on the general danger signs to identify those critically ill children, and doing also proper treatment to those for sick children, and doing referrals to those who needed referrals.
Fanikio kubwa tuliloona ambalo maambukizi ya malaria yamepungua sana ni kwa sababu wananchi wetu wameweza kupata hizi dawa kwa urahisi, kwa sababu tiba kamilifu ya malaria ni sehemu pia ya kinga ya malaria. Kwa hiyo ADDO imechangia sana kwenye kinga ya ugonjwa kama malaria, lakini pia na tiba kamilifu ya malaria kwa kuweza kusambaza hizo dawa mseto.
Kwanza msimamo wetu sisi na mpango mzima ni kusogeza huduma kwa wananchi. Wananchi wetu wengi wanakaa vijijini ambako hakuna miundombinu, hakuna huduma zingine, na mpango mkakati tulionao ni kusogeza hizi huduma. Sasa mpango huu umesogeza hizo dawa kwao, kwa hiyo inaendana kabisa na sera nzima ya kusogeza huduma.
Sasa hivi huduma za upatikanaji wa dawa katika maduka dawa muhimu inaridhisha sana. Dawa hizi sasa zinapatikana kwa uhakika na ubora ambao unakidhi kwa taratibu zetu na kanuni ambazo zinaelekeza.
The government of Tanzania, through the Ministry of Health and Social Welfare, also passed a new Dukla Dawa Muhimu regulation, phasing out the Dukla Dawa Baridi and requiring all shops to be accredited by January 2011.
Kufikia tarehe ile ambayo imetumwa kwenye kanuni tarehe 15 Januari, ukweli ni kwamba tayari tumeshafikia mikoa yote 21 ya nchi hii. Pamoja na kwamba utekelezaji umekuwa katika hatua mbalimbali.
The Tanzanian Parliament passed the Pharmacy Act of 2011, which mandated the Pharmacy Council to oversee the private pharmaceutical distributors and retailers, including Dukla Dawa Muhimu, a role previously played by the TFDA.
The enactment of the Pharmacy Act of 2011 has given more mandates to the Pharmacy Council to look after the pharmaceutical premises, including retail pharmacies, wholesale pharmacies, and accredited drug dispensing outlets.
MSH collaborated with the Pharmacy Council and programme stakeholders to identify the following important areas related to ADDO programme maintenance and sustainability. The first area was to ensure continuous availability of ADDO dispensers by engaging health training institutions to provide the courses.
Currently, we have institutionalized ADDO training program because we understood this is a continuous practice. So, looking at ourselves, we thought institutionalization to zone health training institute could be a way forward which will be more sustainable. So our role will remain to look for the quality assurance of the training that is given.
Kitakapomaliza mafunzo haya, nategemea kuwa na duka langu binafsi la dawa ambalo kwa kweli litatumia kanuni na sheria ambazo nimejifunza katika chuo hiki kuliendesha hilo dawa kwa uaminifu na uadilifu.
The second maintenance and sustainability component was supporting the formation of ADDO provider associations to promote self-regulation, peer supervision and mentoring, improve communication among members and with regulators, and improve their business through other income-generating activities.
So during the ADDO program implementation, it became very clear that formation of ADDO Providers Association could become an important contributor in the sustainability of the ADDO initiative. So MSH worked with TFDA, Pharmacy Council and Medianet to develop a strategy that includes a toolkit which will help different districts organize themselves and how to form the association in a stepwise approach. Currently we have over 30 associations countrywide in different districts, and we now see the different advantages that are within the formation of the associations.
Bagamoyo Drug Shop Owners Association was established in 2010 with 24 members. Up to now, there are 33 members. We have a total of more than 10 million Tanzanian shillings, which is at our CRDB bank in Bagamoyo.
The third component was to strengthen the Pharmacy Council's information system by creating a web-based database and mobile phone-based applications. The applications improve premises and personnel registration and management, reporting on services that ADDOs provide, and communication between ADDOs and PC through text messages. There is also an application that allows fees to be paid using mobile money.
Faida ya mawasiliano kwa njia ya simu kati ya baraza la pharmacy na maduka ya madawa inatusaidia kupunguza gharama kutoka sehemu tulipo kwenda baraza la pharmacy. Inatusaidia kupata majibu kwa haraka tunapouliza maswali. Inatusaidia kupata taarifa mbalimbali kama mfano dawa fulani imefungiwa hazihitajiki kuuzwa katika maduka ya madawa.
The ADDO initiative is now spreading in other African countries with similar medicine access challenges. With support from Bill and Melinda Gates Foundation, MSH worked with the Ministries of Health in Uganda and Liberia to introduce programs based on the ADDO model. Representatives from other countries have also visited Tanzania to learn about ADDOs.
The representative of the President and as a representative of the government of Uganda today, I would like to have the privilege, and I now officially launch the Accredited Drug Shop program in the district of Kibale.
Thanks to the ADDO program, more Tanzanians are accessing quality medicines and services. The objective now is to sustain the improvements and to continue integrating ADDOs into the national health system to benefit public health.
ADDO program is one of the model of implementing public-private partnership to ensure the availability of essential medicine to people living in rural areas, as it has been directed in the Health Sector Strategic Plan 4 of 2015-2020.
I am very confident that the program here in Tanzania, the ADDO program, will be a very successful program. I have seen the enthusiasm that the people have embraced the project with. They have really taken it on. It is their project, and they are going to make it work.
Kama mamlaka kwa kweli, sisi tunafarijika sana kwamba tumekuwa sehemu ya mpango ambao unalenga kuboresha huduma za dawa katika maeneo ambao kwa kweli huduma hizo ni duni.
At my capacity at the head of the institution, I'm confident that I will lead this ADDO program to ensure it is sustainable and all standards are maintained despite regulatory challenges we face.